Hi everyone, welcome back to Andrei Berezovsky Health channel. In today's episode, we are diving into lysis of kidney and surprisingly pancreas transplant, quite the eye-opener for me. We are chatting with an expert professor about this high-tech procedure done with the robot Da Vinci. We explore patient risk and why, despite being technically straightforward, not all hospitals can perform it. It's all about teamwork. You see, the operation involves both donor and recipient, which is pretty complex. We'll also talk about what's needed for the surgery, the cost around 20K, the full deal on Da Vinci robot. Plus, it's crucial to bring your donor through evaluating to ensure everything voluntary. It's global standard, really, to ensure ethical practices. Getting ready for this, it isn't simple. It's a big decision to donate a kidney, actually. Currently, if you needed a kidney replacement and the dialysis isn't cutting it, transplantation is your best bet. Stick with us to get all your questions answered by the doctor. Exciting to have you. I have a freestyle. Yeah. I have a questions for you. And is it actually true that the transplantation it's a state of the art in the surgery?
Yes, it is.
Why?
Because transplantation is the only kind of surgery that we don't amputate organs, take out organs. We took the diseased organs sometimes we don't, but we put a new organ, and this is the only type of surgery. We put a new organ and give a functioning organ to a patient. So actually it's quite exciting, and it's a very good surgery. Very satisfying surgery for the surgeons. Well, for the kidney transplantation, there are 5 stages of kidney disease, end stage of kidney disease, and stage 5 is the end stage. So at stage 5, patients need kidney replacement therapy. It's either the dialysis or kidney transplantation. Dialysis is a good choice of treatment because it keeps patients alive until they receive a transplant. But they have a couple of drawbacks. One is with the patients on the dialysis have a low survival rate. So the life shortens in dialysis. In kidney transplantation, patients when have received the transplant, they live a normal life, socially, economically, and their survival is same with the normal general population. Mm-hmm. But with the dialysis, when you're on dialysis, there is a death rate of 10% each year, so it's quite high. It's actually similar to a very bad cancer. So dialysis is a bridge treatment, but it's not a definitive treatment. So transplantation is a gold standard of care in end-stage renal disease, kidney disease. Actually, it's quite safe. To 1 year survival rate for the patient is 99%. Oh. So unless you have a car accident after the transplant, it's most likely that you will survive. And the success rate is about 80% in first 5 years. So actually, kidney transplantation is the most successful transplantation when you compare to the other transplantation types. It's the first first type of transplantation that surgeons have done. So we have been performing this surgery since 1954. Uh-huh. So it's quite a history. So there's lots of science behind it, and through decades we learned how to control the kidney rejection. We perfect the surgery. We perfect the donor surgery. So actually today it's quite safe, and actually it makes a huge difference in patient's life. So when you think about the transplantation, there are two parts: the donation, the donors, and the recipients. So donor surgery is done by laparoscopically or robotically. It doesn't have so much difference. It's actually safe. Or the third option is open. But since 2007, we have been doing this laparoscopically. It's the standard of care. It's good for the patient because the donor is the most important person in the hospital. Why? Because the donor is the only person in the hospital who doesn't need the health care. They came here perfectly healthy, so they need to have they need to receive the highest standard of care. So nothing should happen to the donors. So laparoscopy or robotic surgery gives them that opportunity. So after the surgery, they have the chance to discharge after 3 days. So it's like a cholecystectomy or other kind of surgery. For the recipients, it can be done either robotically or open. So we decide according to the patient and the anatomy, but both surgeries are quite safe, and we have been doing these surgeries for a long time. So it's quite an established surgery. For the donors, for both donors and recipients, we do a true checkup. So we look to their lungs, hearts, the abdomen. We search for the infections, any cancers that they don't know. It's the best checkup in the world for anyone. And after this workup, if they are quite healthy, we accept them as a donor. And laparoscopic surgery is quite safe and very minimal invasive surgery. And the risk of going death with the laparoscopic surgery is 1 in 55,000. So it's very low.
Very low, I agree.
So it's quite safe actually. So with the donor surgery, we started to use minimal invasive surgery, laparoscopic and robotics. For the recipient surgery, again, robotics started to be performed in the recipient. Also, we have loops, some special glasses that they enlarge the surgical field. So we do perform the surgeries under surgical magnification. Like we magnify the field 3 times. We use very fine instruments. We do microsurgery. So transplant surgery is actually sewing the organ to the recipient's vessels. So we use microsurgical instruments, very thin sutures. So there are lots of technical instruments, and it's exciting actually. Within even 5 years, so much changed, and everything is getting better and better. The donor usually can be discharged within 3 or 4 days, but usually they are relatives or friends. We let them to stay in the hospital with the recipients as much as they like, because as I said, they're the most important person in the hospital. The recipients usually 1 week. They admit, and after 1 week they are ready to be discharged. One question is, what about the donors' long-term life expectancy? It doesn't shorten. Many studies showed that the same with the general population. Only difference is very, very, very low. It's about 1 in 1,000. Kidney disease risk increases very low if they don't control their lifestyle. I mean, if they put on weight, if they smoke a lot, if they don't exercise, or if they don't use their medications, if they're on medications, it puts them on very, very low risk. But it's very low risk, and it's acceptable. For the recipients, the long-term life expectancy is best with the transplant, actually. As I say, it's after 3 months after the transplant, it's similar to the general population. So with a good functioning organ, they live a normal life. So pancreatic transplantation, first, who are the possible patients for the pancreas transplantation? So it's done for the diabetes, but type 1 diabetes. Okay, there are two types of diabetes. Type 1 is more childhood diabetes. Patients lack insulin production in the pancreas. The type 2 is the common type of diabetes that we see with our relatives or friends, is more resistance to the insulin in the body, and it's more common in the older ages, like after 40s, 50s. So type 1 is the pancreas transplant patients. So they lack insulin production, and without insulin, with the high blood sugar damages the organs. Like they cause problems with the eyes. The diabetes is the primary cause of the blindness all over the world. They produce heart problems. They make people more prone to the heart MI, cardiac infarctions. Also, they cause problems with the kidney. Diabetes damage the kidneys. And with the type 1 diabetes, when those patients are they lost the kidneys and they need the kidney transplants, if possible, we give them the pancreas transplant, either same time or after the kidney transplant, to protect the kidney. So after pancreas transplantation, patient becomes non-diabetic, so they get rid of insulin. So it protects kidney, and then the patients have a very long survival.
Sorry, however you take pancreas for transplantation? Kidney is understandable, but pancreas?
Pancreas, you need a cadaveric donor, so you need a deceased donor. So you need to have someone who is dead, donated organs, and you need to take the pancreas from a dead person. So that's the main problem with the pancreas. Well, the problem with the pancreas is actually, if you are you have a good training in the past and you know the surgery, actually it's a very standard surgery, but pancreas is very fragile organ. So with any low blood flow, with any problems, they tend to have damages and cause problems to the patient. So it's, when you compare with the kidney transplantation, it's a little bit more risky and complex operation, and for that reason we pick the patients, the candidates for the pancreas transplantation very carefully. It's another process. Transplant is a very complex process. It's a multidisciplinary treatment. So you need a nephrologist for the kidney transplantation. You need an immunologist, immunology lab, pathology, and then all those different departments. And because it's very complex, and it's also those physicians need to be educated on this transplantation very well. It's not a regular operation. So the background of those team should be good, and they need to be in the high standards. Like children is not a small adult. That's true for the whole medicine. But kidney transplantation is very important for the children, more than adults actually, because one of the function of the kidney is produce growth hormone. So growth hormone is the hormone that grows the child. So with the child with kidney disease, they tend to stay small. They don't grow as they should be. Sometimes in the long term they cause some retardations in growth and actually mental status. So the kidney transplantation is actually more important in the children. And with the proper technique and the experience, it can be done even from the parents. We can put the adult kidney to the children. It's just the plan.
It's adult kidney for the children is it's normal situation. Yeah?
Normal, yeah.
Okay, I
From
see.
the parents, yeah.
Okay.
And also, its package includes, as we said, transportation from the airport, and also translated hospitalization of a patient, also the companion, of course, of the donor with them. If we talk about the procedure of the kidney transplantation, actually we need some documents such as epicrizal, also radiologist results, and also there is some conditions we can reject actually the kidney transplantation. There is two conditions. One of them is incompatible blood type, of course, between the donor and the patient, and second thing is there's an active infection in the donor or actually in the patient. We can reject this procedure, of course. And also, if we talk about the duration of the patient who will stay in the hospital of Ankara, it depends actually if there is a doctor in the city or in the city where patients live. And if we talk about the duration, actually it's changed if there is any doctor and equipment in patients the country he lives in. We can discharge the patient maybe between 7 and 10 days actually, but of course we can coordinate with the doctor there and our doctor to keep him in following up. If there is no equipment or no doctor in his country, we can say the patient have to stay with us actually in Ankara or in Turkey, actually approximately about 1 month, of course.
Here on the Berezovsky Health channel. Don't forget to hit subscribe for more of kidney transplant.